Guys both for joining. Um, I'm excited to get to know where you're coming from. I see we have a Greenfield, Wisconsin, which is great. Since it's a small group today, this is going to be a pretty informal session, so feel free to let me know if you have any questions as I go through my presentation, either in the chat or at the end. I'm going to have a Q&A session that's live, so feel free to just take yourself off mute and ask your questions then. This session is being recorded, so if you don't want your face on camera, just turn your camera off, and that'll be good. And then I'll share it out with everyone afterwards, so that you can look through the demo again or anything else that you might find useful. But yes, my name is Callie. I am the program coordinator here at the City Health Dashboard. I have been here for a little over a year now, and I work on both projects, but today we're going to be focusing on the City Health Dashboard site. We're going to be focusing a bit more on mental health today, but I'll also be giving a brief overview of the City Health Dashboard project, as well as our website overall, to kind of give us an orientation to what we're looking at, and then we'll dive a bit deeper into our mental health related metrics and resources. As I said earlier, we'll have a little Q&A at the end of the session, so if you have any questions, feel free to ask then, or if you have a specific city or metric that you want to go into, I'm happy to spend the time today to look through those things. But to start us off, here at the City Health Dashboard, our goal is really to help cities across the US leverage the power of data to improve the health and well-being of everyone in their community. So we do that for over 970 cities right now. We are continuing to grow to include more cities every single year. So we have a few initiatives that we have, such as the Put Us on the Map challenge, where we add smaller cities. Right now, we have every city that has more than 50,000 individuals in their population. And then for the past 3 years, we've been adding quite a few cities that have thresholds as low as 1,000 individuals in their city to the dashboard, because we know local data can be helpful for every city, no matter how big or small. We launched the dashboard back in May of 2018, so we've been around for nearly 6 years now, which is crazy. We are situated at the NYU School of Medicine in the Department of Population Health. We work really closely with the NYU Wagner School of Policy, as well as some of our partners like NLC or ICMA. When we first launched the site, we launched with 4 partner cities, pilot cities, that helped us really learn what cities wanted out of data and how we can be that resource for them to be really a one-stop, easy to use, accessible resource for everyone. Today, we have over 40 measures of health on the site, including factors that both shape health and drivers of health equity. And this summer, we're having an additional data release to release over 100 new cities onto the site, as well as a few more metrics, which is really exciting. So, as I said, our goal is really to just be an easy to use one-stop resource for every user. We try to target our site to really be helpful for any person, no matter their data literacy level, but really ideally for health professionals, city leaders, everyday community members, anyone that could find any use in health data pretty much. We do this by developing and testing our site and metrics with a diverse group of community and city leaders. We continually approve upon and upgrade our site. So we have about 2 annual data releases, as we call them, where we update our measures with the data as soon as it's available for every single city that's on the site. So once your city's on the site, those updates will apply for your city. We make sure that we check that every metric is really action oriented, so something that is able to be used, and we have a very stringent criteria that we base our metrics on. So as long as it fits into our criteria, it's something that we feel like is worthy for our users to be able to see and use in their public health initiatives. So to do so, these are some of the criteria that we use. All of our data that we put onto our site comes from a national data set. We make sure that there are rigorous methods underlying the original data collection. So we want to make sure that any data that we put on the site is something that we ourselves can stand behind. All of our measures aim to be actionable and reflect upon public health priorities at the city level. And then we also ensure that we regularly update as soon as these data are available. We make sure that those are reflected onto our site as soon as we possibly can. We do this over 5 overarching main domains. So on the dashboard, we have clinical care, physical environment, health outcomes, health behaviors, and social and economic factors as our 5 overarching domain. Currently, we have over 40 metrics that take up part that are in all of these different domains, and quite a few of those, as you can see by this little icon here, include also a demographic breakdown availability, which means that you can view these metrics for your city broken down by sex, age, or race ethnicity, which can be really helpful to give you an even more granular view into some of these data. Now, most of these data are available at both the city and neighborhood level, which means that you'll be able to view them at the census tract level. It is a proxy that we use on our site to kind of replicate what that neighborhood would be at the local level. And then the ones that are in blue are only at the city level. So that's kind of the wide city boundaries that you can see. So all that being said, what do people actually use the City Health dashboard to do? We hope that any user can really use the dashboards to be able to compare health gaps across neighborhoods and dig deeper into what is causing those differences. We like to think that the dashboard can be used to compare your city to other cities in other regions or with similar population sizes or demographic factors. And this can help in goal setting and learning from what others are doing. And then finally, we think it's really helpful in setting priorities and better target resources to neighborhoods that can need them the most. And sometimes our data can really reveal where are those neighborhoods in your city? Are they where anecdotally you thought they were, or is this showing a different picture? So our data is really helpful in kind of targeting those resources. So all that being said, I'm going to do a really quick site overview. I'm going to go into some of our metrics and show you some of these cool features on our site, and then we'll go into a bit more of the mental health specific resources. So this is the main page that you get when you go onto the City Health dashboard. You're able to put in your city here or any state, and you can see what cities are available, or you can scroll down and see a few other things such as our events, any research we've done recently, or impact story. I'm going to go to my hometown of Burbank, California as an example. And when you click onto this, you immediately are met by all of the metrics that you can click into for your city. Or what I like to do is view the city overview, because this gives you a really general overview of what metrics are available for your city for the most recent year of data, as well as how your city is performing. Now, this scale bar here is going to be used universally across the site to really show how well your city is performing. Lighter colors are always going to indicate better outcomes. And as you can see, as you go through the list, some of these scale bars are actually flipped in the orientation depending on how the metric is measured. So for instance, life expectancy is a metric on the dashboard. If you click into this, you'll see an example of what this map for the city looks like, what that distribution of colors is, and then where does your city lie based on the dashboard city average, which is our proxy of a national average. This number here with the triangle is taken based on every single city that's on the dashboard, averaging that out to see what is that average for the nation. If there's a little green check mark above your orange bar, which indicates how your city's doing, if the check mark is there, it means that you're performing better than the dashboard city average. And if it's not there for a particular metric, that means you're performing below the dashboard city average. So as you scroll through here, you can see that there's quite a few metrics to look at. I'll click into high school completion. And here we can see that Burbank is performing better than the average of the dashboard cities at 93% completing high school. But you can see that depending on the neighborhoods within Burbank, they tell a different story. So for instance, in this neighborhood, we're at 81% versus over here, we're at 98.2. And those are pretty close neighborhoods geographically. So you can see how this starts showing you a different picture at this neighborhood level data. Here you can sort it into any years of data that we have available. So you can go as far back as 2013. So as this map loads, you'll see that the dashboard city average moved closer to the Burbank city average, but Yeah, so now that it loads, you can actually see that some of those trends that we saw in the most recent year data, they look a little different in 2013 than they do now in what was the most recent year in 2021. So it's interesting to see how things change and how the data reflects those changes in your neighborhood. If there are particular neighborhoods of interest that you'd like to see and you want to hang on to, you can star them here and they'll actually pop up on the right in the saved census tract category. So if you put this little eyeball icon on, it'll actually highlight the tracks that were saved. So I'd previously saved this one, and then I've also saved this one, and maybe I'll save this one as well. And then if you go to other years of data, you can see that those same, maybe I'll go to 2013 that was already loaded. You'll see that those same tracks highlight as well. So that can help you even better kind of narrow in on those areas that are of most interest to you. I'm going to go back really quickly to the city overview page just to show a little more detail that we can get in the data. So that's what a metric looks like if you dive into it. Here you can actually look at some demographic information at the city level before you go into metric specific demographic data. So if you go here, you can see how is this city broken down based on certain demographic information. You can even break it down even further into subgroups within demographic categories. And then if you want to, you can even look by census tract. So as this loads, it'll show you what is the distribution for certain demographics within your city at the census tract level. And again, census tract is what our proxy is for about a neighborhood level. And this is taking a moment to load, so we'll just give it some time. But here you can even sort these census tract demographics into different age groups, and you can see how that's distributed throughout the city, or you can do it based on racial, ethnic distributions. This is taking a little long to load, so we'll move on, but maybe we'll come back to it at the end. But the other demographic information that we have available, so that's at the city level that I just showed you. You can find that in the city overview tab here at the top. But if you're on a specific metric, so in this case, we were looking at high school completion in 2013, you can then look at what demographic information is available for that metric at the city level. So here we're looking at Burbank's in general. About 88% of folks in Burbank graduated high school as of 2013. And then you can see what are those numbers actually for different demographic breakdowns. So we can see here that the Asian population in Burbank, 95% of them were graduating high school, 90% of the Black population, 77% of Hispanic, 90% of white, and 78.6% of others. So you can kind of see how those are performing based on the dashboard city average of those certain population groups and other cities. So that's an interesting way to see this data broken down even more. If you scroll down, you can also see that this is broken down by sex as well. So you're able to see the female versus male breakdown. That's demographic detail. I'm just going to keep moving across this kind of navigation bar up here. The next tab is compare cities. So say you want to, let's go back to 2021 for more recent data. Let's say you want to compare Burbank's high school completion rate to another city. Maybe you want to compare it to a city that you already know, in which case you can just type that in immediately. Or you can actually look for cities that share certain characteristics. So either general characteristics that they share with Burbank or dashboard metric specific characteristics. Here, it'll show you the ranges at which Burbank, the city, falls, and you can select cities that match those similar ranges. Or you can go here to general characteristics, and I will select cities that have a similar population level. You'll see 102 other cities on the dashboard have a similar population level to Burbank, and then you can compare from there. I'll choose Chino, California, and then you'll see that this pops up here and you can see how Chino, California is doing compared to Burbank, as well as any demographic information that is available. As I'm going through this, if you have any questions, feel free to pop them in the chat, and I'll get to them after the demonstration, but we're just going to continue moving along this navigation bar. Next, we're at compare metrics. So say you have high school completion 2021, and you want to compare it to, for instance, rent burden. You can click on rent burden. You'll see that the most recent year of data is also 2021. And here it's going to show you a map, just like the one that you saw in the initial metric detail. But now it's going to have another data point, which are going to be this rent burden. It's going to be showing up as circles this time, as opposed to full shaded squares, or I guess these aren't squares, but census tracts. But the same scale bar, light to dark, is going to apply for here. So anywhere that has a lighter circle and a lighter blue shade, those are places that are performing better. Anywhere that has that darker red circle, those are performing worse for rent burden, versus darker for blue is worse for high school completion. So this allows you to kind of navigate through all these different portions. And you can also see this comparison here in a scatter plot view, which is a nice way to visualize the data outside of just these map views. The last thing that I want to highlight, and you can either access it here at the navigation bar or actually here at the main menu on the left, are these take action resources. So having data is great, but you also want to know what you want to do with the data or how you can possibly implement this data in your city. So we've actually compiled a nice curated list of resources to help you figure out how to move from data to action in your city. So one way that we do this is through programs and policy suggestions, as well as partners, strategies, funding, and measuring impact. We have certain ways that you can sort these as well. So say you're interested in high school completion, you can sort this down to just high school completion. And it will give you resources that might help you support your community with high school completion, as well as other strategies or funding opportunities. So that's the walkthrough of the site. I know that that's a lot of information to kind of take in and digest. I would highly recommend going through the site on your own and kind of navigating around and seeing what sticks, what doesn't, what questions you might have. I'm here to also help walk through your city as well in the Q&A at the end. But to round out this session, I'm just going to go through a few of our mental health specific resources that we have on the site. So again, this is a big list of all of our metrics that we have, but I've called out a few specific metrics that relate to mental health. So the first one being frequent mental distress. This is a measure of the percentage of individuals in your city who have been experiencing mental distress for more than 14 days over the last month. So basically people that are, as the metric says, frequently mentally distressed. This is a good proxy for individuals that might be, experiencing bouts of anxiety or depression or other things such as that. So this is our main mental health metric. But there's a few other ones in here that we think kind of relate to mental health. I just want to make sure. Oh, that's a sneak peek for our next slide. But here we can see all these metrics that I've called out that I think relate to mental health. So uninsurance, so that relates to whether or not an individual has health insurance. Park access, so ability to access green spaces within their communities. Firearm suicide rates, opioid overdose deaths. Those are health outcomes that can relate to mental health. Children in poverty, credit insecurity, rent burden, unemployment. These are rates of just social and economic factors that might affect your mental health. So we have all these metrics on the dashboard. As you can see, a lot of them do offer demographic information breakdowns as well, and most of them are at the neighborhood level as well as at the city level. Another thing that we do here at the dashboard is that we do perform a lot of research using our metrics. So every data point that's on the site is available to be downloaded for free, and you're able to, do any analysis or exploration of that data to further your understanding of your city's conditions. And so we have actually taken some of this data, our team, and we have done some research on it, and we compared credit insecurity to frequent mental distress. We found that I think it was about 80 or 100 US cities that we examined, the more credit insecure tracks, so the places in which individuals realized more credit insecurity, were places that had higher prevalence of frequent mental distress. So that's an interesting association. And we found that in the Midwest, this was an even higher or stronger association than in other places in the country. So this is an interesting way in which you can see how our data can kind of be pulled and analyzed in different ways that might be of interest to you. Another thing, as I mentioned earlier, was we do have this Take Action Resources page. So here I've actually called out the metric frequent mental distress. And these are like the top results that come up. They're in alphabetical order, but these are some examples of programs or policies that cities have used or implemented. A lot of them are evidence-backed, which means that they have been proven policies that have been effective in kind of targeting this specific metric. So in this instance, lowering frequent mental distress rates. So these are some really helpful resources of how, again, to move from that data point to action. Finally, I'm going to highlight some impact stories, as we call them. So these are cities that are on the dashboard and use our dashboard data and how they are doing so. So the first one I wanted to call out is Decatur, Georgia. They actually joined our site last year during the Put Us on the Map challenge. So they are a smaller city, just outside of Atlanta, I believe, and their fire rescue team applied to join the site. They've looked at our data on physical inactivity, neighborhood, racial, and ethnic segregation, as well as frequent mental distress to try to understand what might be some underlying causes or underlying associations with emergency medical services, which the fire rescue team provides first response to. So they wanted to understand, where should they be targeting resources, where in their community is experiencing the most distress, and how can they start proactively putting in preventive services to kind of help these community members more. So they've been able to use our data to do that, and they're actually using our data now to apply for some funding opportunities and grants to help move forward these projects. Another example is Arkansas Center for Health Improvement. So in Little Rock, Arkansas, the ACHI overlaid frequent mental distress, frequent physical distress, and children in poverty onto maps with their local school district geography. So as you can see here, the ones in red are the public school ratings for their different school districts, and then the ones in the shades of blue are from our data. So this is overlaying Little Rock specific data with our local city data. And you can see how there's certain correlations that pop up, and they can see how they can drive action towards policy change like rezoning or a healthy policy so school districts can improve health and educational outcomes in certain areas. So this is a neat way to show how you can use our data that's downloadable and use it with your own local surveys or data sources to try to see how you can correlate those and really move towards improving health and well-being in your community. So that's my whole spiel. Thank you guys for sticking around. I'm really curious if anyone has any questions. Now is the time. You can take yourself off mute, put them in the chat. I'm happy to walk through the site again if anyone has specific questions about metrics or their specific city or anything at all. I'll be here for the rest of the hour. But if not, thank you so much for joining us today. I hope you enjoy exploring the site. And yeah, I'll hang around if there's any questions.
I had a question. Can you hear me?
Yes, I can hear you. I was the one on
I
mute.
didn't know how many people were on here or if I was okay. So I'm working with Louisville, Kentucky. Have used the site a whole bunch, but I'm a grant writer, and I'm working with a small city, New Albany, Indiana, which is outside of Louisville, but obviously across the state line. Not on the dashboard, but I don't really, other than going to these metrics, individually themselves in that data, is there any options for seeing? I didn't see like statewide Indiana type data unless I pick, like Bloomington or somewhere near there.
Right. Yeah, so our site, unfortunately, we don't give those statewide numbers, and unless the city is on the site, we really try to narrow into city specific data. First of all, I'd say 100% you should see if, and for the next Put Us on the Map challenge next year, unfortunately, the deadline for this year has passed already, but applying for that other city to get on the dashboard would be a great opportunity to just get them this local level data, and then once they're on it, they'll have it forever. But The other opportunity that I would say might fit your bill is that we actually have a sister site called the Congressional District Health Dashboard. And they have, yes, thanks, Hannah. So they are our congressional district level dashboard. It provides most of the same metrics that we have on our site, but at the state as well as congressional district level. And I can actually show you that site now. What I
That'd be
would suggest
fantastic. Yeah.
is, yeah, going to this site, and then you'll be able to look at that state level view or zooming into those specific districts that are relevant to your specific, I guess, cities. Do you mind repeating what was your
You
state?
went to, it's New Albany, Indiana. It's 47150.
So we can
I'm
see.
actually in Canada, but that's kind of
Oh,
where,
I'm
yeah.
Canadian. Where in Canada are you?
I'm in Fredericton, New Brunswick in the Maritimes.
Oh, nice. My family lives in Nova Scotia, so
Okay, okay, another Atlantic.
yes, we love Atlantic Canadians. Okay, I love whenever I do my demos, it's like my computer stops working. But um is there any particular metric that might be of interest?
Um, yeah, let's see. Some of that health. What was the one? I think it was the mental health.
Yeah, mental distress.
Yeah, something like that. I was kind of thinking of like the substance abusey kind of youth stuff, but
Okay, yeah.
yeah,
Yes. As you
okay,
can see here, I'll just show this again, but we have most all of the same metrics that the City Health Dashboard has. There are a few that we don't have here, such as like park access. When we were creating the site, we were like, that's not as useful at the congressional district level. But we have other ones here that we don't have on the other sites, such as
okay,
Medicaid enrollment. So you get a little bit of different information, but still very similar. And here you can see it at the national level, a little overwhelming. So then you can go in, and thank you, Hannah, for finding that. It looks like Indiana ninth would be the relevant congressional district. So here you can kind of zoom in, and you can see how Indiana ninth is performing for this particular metric. You can
okay.
even show census tracts, which is basically what our
Oh,
city site
great.
does. It
Okay.
takes a minute to load, but once it does, you're able to zoom in. And you said you're in Louisville, right?
Well, the agency, I'm generally working in Louisville, but they have a satellite in New Albany. So yes, I've
Right.
definitely used it in
Get
Louisville
this-
before.
You can line up the census tracts for the city on this, for New Albany on this zoomed in view and
Okay.
get your data at least, kind of
Yeah, I see.
approximate that data.
Yeah, so this is like a nice alternative when your city is not actually on the city
Yeah.
dashboard. You can come to this site and kind of get very similar information. And for a lot of our metrics here, census tracts are available. So you can really get that still city level view. It's not as, curated, I guess, because you kind of have to do a bit more searching, but it still can get you that information. And this is also available for download. So you can kind of manipulate the data on your own if that's.
Okay. Thank you so much. Great work. Love what you do and appreciate it.
Yeah, of course. I'm glad you're using our tools.